Hello and welcome to our Healthy Minds, Healthy Bodies seminar, Hand and Wrist Pain, Preventing and Treating Carpal Tunnel Syndrome. We're very happy to have Dr. Erin Campaigniac from Samaritan Medical Group Hand and Shoulder Orthopedics in Corvallis. And with that, Dr. Campaigniac, you can take it away.
Sounds great. Good afternoon, everyone. I am Dr. Campaigniac, and I am a hand and wrist surgeon. I am originally from upstate New York, and I trained in Massachusetts, and I definitely enjoy long walks on the beach. But also, one of my hobbies happens to be hand surgery. I love what I do, and it's very important to me to educate patients about hand and wrist problems and get people back to doing what they love and need to do. Everyone uses their hands all the time, so you wear them out and I'll fix them up. In all seriousness, though, this is my passion, and treating carpal tunnel syndrome is one of my favorite parts of my job. It's a clear-cut mechanical problem with several solutions, and they are very effective. I'm going to start by telling you more about my field, hand surgery, and then get into the nitty-gritty of carpal tunnel syndrome, what it is, how to recognize it, modifications you can make at home to feel better, and then more invasive treatment options that I can offer. Our hands serve many purposes. Hands help us eat, dress, write, earn a living, and have fun. To accomplish these tasks and activities, our hands require sensation and movement, and this is produced with our nerves, joints, and tendons gliding with muscle contraction. When there is a problem in the hand or wrist, care must be given to all types of tissues that make our hand function possible. Hand surgery is the field of medicine that deals with problems of the hand, wrist, and forearm. The hand is a unique area in the human body in that it's made up of bone, joints, ligaments, tendons, muscles, nerves, skin, and blood vessels. These elements must be in all good working order for the hand to function well. The relationships between these structures is delicate and refined. An injury or disease can affect any or all of these structures and impair the use of the hand. Hand surgeons care for these problems without surgery, and we are especially trained to operate when necessary. Hand surgeons are fully trained, board-certified orthopedic, plastic, or general surgeons with additional specialized training and certification in hand surgery. The structures of the hand and wrist are quite small and complex, and as you can imagine, a problem with one anatomic structure can easily result in a problem with another. As you can see here, it can take quite a bit of equipment to fix up a hand or wrist, but don't worry, this was not a surgery for carpal tunnel syndrome though. For every surgery I do, I use special glasses with telescope lenses to see the fine detail. Sometimes I use a microscope, and for work on bones and joints, I use an x-ray machine in the operating room, which is what I'm doing on the right for a finger fracture. The surgeries can be tedious, but that's what I love. Every patient and every case is different, and we are prepared for all of that. Surgery is a team sport. Although the captain of the ship, the surgeon cannot do it alone. The team is more than the sum of its parts. At Samaritan, we have exceptional perioperative and surgical staff, and everyone takes initiative and does everything possible to care for the patients the best we know how. Operating room staff we're a special breed. We see pain and loss, and we try to fix everything. We work in a high-functioning team and know everyone's role. We have to anticipate the next step and all of the possible outcomes that can happen and problems. Then, what we need to do to solve those problems and do it quickly. We're thinking about plans A, B, and C, but also down to X, Y, and Z to keep patients safe and things running smoothly. Although the operating room may be a well-oiled machine, we also take our time to soothe the patients. We've all been there. We know what it's like to be nervous or scared, to have no control over the situation. We comfort you, keep you safe and warm in our operating rooms, then get you home to your family for the coffee and cheeseburger you've been craving all day. Here we are getting ready for a great day of saving lives, one carpal tunnel at a time on New Year's Eve morning. So now, let's start talking about carpal tunnel syndrome. Carpal tunnel syndrome is essentially a pinched nerve in the wrist. The carpal tunnel in the palm side of the wrist is a narrow, oval-shaped space made up of the carpal bones of the wrist and the strong ligaments in the palm. In it contains the median nerve, which allows you to feel most of the hand, and 9 tendons that flex your fingers. The bottom picture shows a cross-section of this with the nerve at the top of the tunnel and all of the tendons under it. The wrist bones form its floor. Carpal tunnel syndrome is when swelling in this tunnel puts pressure on the nerve. The carpal tunnel is a naturally tight space, and the median nerve is at risk for compression in this location. Nerves are delicate and do not like extra pressure. Symptoms of carpal tunnel syndrome include numbness, tingling, weakness, pain, electric shocks, and waking up at night with your hand falling asleep. The numbness or tingling most often takes place in the thumb, index, middle, or ring fingers. The feeling in the small finger is supplied by a different nerve, so that's why it's not usually numb in carpal tunnel syndrome. The symptoms are usually felt during the night and can even radiate up the arm, but may also be noticed during the day activities such as driving, talking on the phone, or reading a book. In severe cases, sensation and strength may be permanently lost. Carpal tunnel syndrome is caused by a narrowing of the carpal tunnel or swelling within it. Pressure on the nerve can happen from swelling along the tendons, joint dislocations or fractures, arthritis, pregnancy, or other conditions such as obesity or diabetes. Sometimes carpal tunnel syndrome can get worse with certain activities or position of the wrist or shoulders. Work that requires forceful or repetitive hand movements, vibration, or working for long periods of time in the same or awkward positions don't do you any favors. Think about how you hold your electronic device when you're binge watching the latest Netflix series. Your doctor will take a detailed history that includes other medical conditions or prior injuries, and this is relevant to hand problems. We discuss how the hands have been used and when symptoms arise. An X-ray may be taken to check for arthritis or fracture, and in some cases, laboratory tests may be done. Electrodiagnostic studies, called nerve conduction studies, is often done to confirm the diagnosis and check for other possible nerve problems. Carpal tunnel syndrome may often be relieved without surgery. Some treatment options include changing the pattern of hand use, which helps reduce the pressure on the nerve. I will discuss hand therapy and positioning in the next slide. Wearing a wrist brace to keep the wrist in a straight position, particularly at night, helps reduce pressure on the nerve and alleviate the symptoms that prevent sleep. An over-the-counter wrist brace keeps the wrist straight so it is not bent or flexed during sleep. Otherwise, you'll wake up with a numb hand and your hand numb and tingly and have to reposition your arm and shake it out to get the feeling back. The gray splint shown here is a relatively small and soft one. It does have the metal bar to keep your wrist straight, but it's simple, light, and easy to wear. The dark blue splint has a squishy pad supporting the hand, and this is also very comfortable to wear at night. Oral anti-inflammatory medications may help for flares and can have short-term relief. NSAIDs, or non-steroidal anti-inflammatory drugs, are oral medications used to reduce pain and inflammation. They can be purchased over the counter, include Aleve or ibuprofen and Aleve or naproxen. Sorry, my mistake. Include Advil or ibuprofen and Aleve or naproxen. We do not recommend their long-term use due to potential side effects such as increased risk of gastrointestinal bleeding, kidney disease, and heart conditions. Steroid injections into the carpal tunnel can help reduce the swelling around the nerve. Corticosteroid injections are commonly used by orthopedists and hand specialists and are often called cortisone shots. Corticosteroids are steroid hormones produced by the body. They have many different biologic functions, one of which is regulation of inflammation. If used carefully and sparingly, steroid injections are safe and have few side effects. Having steroids injected into the same location multiple times can cause problems, though, and this is not usually recommended. Most patients have at least temporary relief from carpal tunnel symptoms with a steroid injection. It can be several months to long term, and it is recommended along with other non-operative techniques. Steroid injections will not cure carpal tunnel syndrome in severe cases. When symptoms are so severe or do not improve, surgery may be needed to make more room for the nerve. I will talk about that in more detail in later slides. Beware of cure-all treatments you may find online. If something sounds too good to be true, it probably is. And if someone is trying to sell you something with a money-back guarantee and 100% successful results, think twice before buying. There is also an abundance of information on the internet about just about everything, carpal tunnel syndrome included. I found all sorts of inaccurate information and looking for photos to include in this talk. It's best you consult your doctor if you have a problem that is not improving with time and basic treatment. This is a good representation of how most of us sleep. Notice the curled up posture and flexed position of our wrists and elbows. This not only compresses the median nerve at the wrist, but it also stretches another nerve, the ulnar nerve at the elbow. So the median nerve is pinched and the ulnar nerve is stretched on tension, and this can cause numbness, tingling, and pain in the hands and wake you up. This demonstrates the wrist in a neutral position aided by a splint on his left wrist, and the pillow helps prevent forceful flexion of the elbows. It's not necessary, but it definitely can help. Physical or occupational therapy is also tremendously helpful in managing carpal tunnel syndrome and other nerve problems. There are specialized hand therapists in my office, and they instruct patients on nerve glide stretches and strengthening exercises, particularly around the shoulder blades and shoulders to improve posture. Poor posture is a huge issue with nerve problems, and I cannot stress this enough. Everything is connected from the neck on down to the fingertips, and every minor adjustment can have a tremendous effect on how your hands feel and work. Sit up straight, legs and arms at 90-degree angles, computer monitor directly in front of your eyes. Pinch your shoulder blades back and keep your shoulders down. Consider a cushioned gel pad to support your wrist in front of your mouse, and an ergonomic keyboard or support for your wrist in front of your laptop. Get out of that sustained position at work. Stretch. Foam rollers like this are great. Several studies have shown a reduction in carpal tunnel symptoms when patients were involved in an exercise program, particularly a vigorous physical activity. Go out for walks and stay active in general, and move. Now we'll discuss surgery for carpal tunnel syndrome. During a carpal tunnel release surgery, the pressure on the nerve is decreased by cutting the transverse carpal ligament, which is the top of the tunnel on the palm side of the hand. This releases the pressure off the median nerve and relieves the symptoms of carpal tunnel syndrome. The nighttime symptoms often go away very quickly, while the numbness and tingling lingers for weeks to months as the nerve recovers once that pressure is released. An incision is made at the base of the palm in the hand. Once the ligament is cut and the pressure is released, the skin is closed with stitches that are removed in the office 1 to 2 weeks later. The gap where the ligament was cut is left alone and eventually fills with new ligament growth and scar tissue, but with more space available over the nerve. Carpal tunnel syndrome can recur about 5% of the time. If you have carpal tunnel release surgery, you don't need to stay in the hospital. It is an outpatient surgery and typically requires sedation, so you can go home the same day. Following surgery, soreness around the cut area may last for several weeks or months. The numbness and tingling may disappear quickly or slowly depending on how badly the nerve was compressed and for how long. Sometimes recovery may take several months. Carpal tunnel symptoms may not completely go away after surgery, especially in severe cases, but overall patients do very well with this surgery and feel much better. Although after surgery, patients are typically back to day-to-day activities rather quickly, they should avoid heavy gripping and lifting such as yard work for about 6 weeks. There is still some weakness a couple of months after surgery, but it continues to improve with time. Surgery is the best way to prevent the nerve from being damaged irreversibly. Prevention. In your daily routines at home or while doing hobbies, think about the position of your fingers and wrist. Try to train yourself to use other positions or techniques that won't stress your hand or wrist. Take good care of your general health. This includes staying at a healthy weight, not smoking, and getting regular exercise. Obesity has been shown to be a risk factor for carpal tunnel syndrome. Weight loss may reduce this risk. Restrict your salt intake if you tend to retain fluid. Nicotine is an addictive chemical in tobacco products. It also constricts the arteries and reduces blood flow in the body. The blood vessels in the hand are very small, and if its blood flow is reduced, the nerves can be more sensitive to injury. Stopping nicotine may reduce this risk of carpal tunnel syndrome, among other things. Keep your arm, hand, and finger muscles strong and flexible. Use them or lose them. Keep your hands in a neutral position. For example, keep your wrists straight or only slightly bent, particularly when using the computer or cell phone. Avoid activities that bend or twist the wrist for a long period of time. Use hand and wrist movements that spread the pressure and motion evenly throughout your hand and wrist. Avoid ongoing forceful gripping activities and tasks, and using vibrating tools sparingly if possible. Take breaks and rest your hands. Switch hands and change positions often when you are doing repeated motions. Stop any activity you think may be causing finger, hand, or wrist numbness or pain. Wear a wrist splint, particularly at night. A splint can keep your wrist in a neutral position, that is, not bent too far forward or back, and reduce the pressure in your carpal tunnel. General flexibility and posture go a long way for conservative management, especially for prevention and new symptoms. Stretch and move. Not all hand pain, numbness, and tingling are caused by carpal tunnel syndrome. If your symptoms are progressive, severe, or not responding to treatment, get an evaluation by a hand specialist or your primary care physician sooner rather than later. The internet is chock full of opinions and information, but unfortunately, much of it is not medically sound. Please be aware of recommendations you find and products for sale. This is the American Society for Surgery of the Hand website, and it has a wealth of patient information about many common hand and wrist conditions, as well as ways to find a fellowship-trained hand surgeon. I am not only a hand surgeon, but I am also a patient. I suffered with carpal tunnel syndrome for several years. It began after I had my first baby and continued to worsen. It was difficult to pinch and grip to buckle a car seat. My hand would go numb while reading a book. Using a cell phone frequently as my new age pager for work, coupled with hours of computer use with our electronic medical record, things only got worse with pain. I grip, pinch, and pull when I'm operating, and I use various sized tools in surgery. Then I started to notice more regular pain and even weakness. I have many years left to do a good job for patients, so it was important to get it taken care of when conservative treatment wasn't enough. These were the people I used to work with before I moved to Oregon, and they took great care of me. It's also one of my favorite surgeries for me to do because patients typically notice an improvement in their symptoms within days of the nerve being released. It's awesome. Between our day-to-day activities, associated medical conditions, and now the marriage to our cell phones and computers, both for recreation and for work, now more than ever, it's common to develop upper extremity problems. The good news is there are often straightforward modifications we can incorporate to feel better. Be mindful of how you hold your phone or tablet. Correct your posture at the computer. Wear a wrist splint at night. Stay active in general, and when you are sedentary at work, get up and move as often as possible. Our nerves need to move too, and they need blood flow and oxygen to stay healthy. This is our team of hand surgeons, physician assistants, and hand therapists in our hand to shoulder orthopedic office. We all communicate well with one another, and our goal is to streamline care for patients and get everyone out doing what they need to do for work and love to do for enjoyment. We are a very cohesive group, and I feel so fortunate to be a part of this team. Here are many of our clinicians and office staff. We pride ourselves on compassion and efficiency and really do our best as a team to care for every patient's needs. It really is wonderful to see everyone's smiling faces without masks in this picture when we got together for the women's basketball game as a New Year celebration last year. Let me tell you a little bit more about hand to shoulder orthopedics. Although carpal tunnel syndrome is one of the most common conditions we treat, we also take care of tendon, bone, joint, and other soft tissue problems in the hand and wrist. Like carpal tunnel syndrome, even though we're an orthopedic surgery office, we offer non-operative treatment options when appropriate. Not only do we take care of chronic problems that have been going on for weeks, months, or years, but we also manage hand and wrist traumatic injuries. We are called into the hospital for hand and wrist emergencies, and we also fix urgent injuries involving bones, tendons, and nerves as outpatient surgery. This is our phone number and our address. It's tricky though when you plug it into a GPS because that will take you to the front of the hospital. We are up the hill around the back. If you turn onto Elks Drive from 99W, the second right is Kronk, and that takes you to our popular parking lot at the back of the hospital. Sure you have questions, so I'll turn it over to that feature and do my best to answer what I can.
Well, thank you, Dr. Campaigniac, for telling us a little bit about carpal tunnel syndrome and your team at the clinic, as well as your own story. That was awesome. We do have some questions here for you. The first question is asked is Tai Chi, yoga, or are there any other exercises that you can do to, kind of help prevent carpal tunnel syndrome?
That's a good question, and yoga and Tai Chi are phenomenal just for general health, mental well-being, and strengthening, flexibility. The problem that I've seen with yoga in my hand surgery practice is that extended wrist position and direct weight bearing on the hands in positions such as plank or downward dog and many other yoga positions. There are other ways to certainly modify to avoid that position. And I feel like patients who have carpal tunnel syndrome also have some discomfort, sometimes even pain and numbness in those direct weight bearing postures in the hands. But again, there are other ways to modify with your wrist in neutral that may be better tolerated. I found that after I had my carpal tunnel release, in fact, it took maybe 5 months before I really could do a plank pose or a push-up because of the soreness on my hand, even after the surgery. So that's one of the last things I think that comes back to after having a carpal tunnel release surgery. I think Tai Chi is much lower impact anyway, and I think that that's certainly a fair option. Again, for flexibility, just generalized motion and blood flow to the nerves. So both great options.
Excellent. Our second question, and it's a three-part question. So if you need me to go over this again, I will. But the question is, how often can you get corticosteroid injections for pain? How long would a typical injection last? And if you get more than one, would injections like these compromise the joint or the bones over time?
Sure. As far as how often you can have injections, it really depends on how you're responding to them. If you have great relief of your symptoms and you've gotten 6 months or a year of relief, I think it's reasonable to do that again. If they become more frequent and you need them more frequently, or you have only a couple of months of relief, to me, that's a fail in the injection. We definitely confirm that you have carpal tunnel syndrome because your symptoms wouldn't go away with the injection if you didn't have carpal tunnel syndrome, for instance, if you had a problem with your neck. But just having a few months of relief with those symptoms, to me, it means it's not an adequate treatment, and you probably would require surgical release to treat that. As far as how long they last, that's variable, and that's one of the things we can't really predict. In someone with mild carpal tunnel syndrome, milder symptoms with numbness and some pain, really not having the weakness or dropping dishes type symptoms, when we get the nerve conduction studies, usually the nerve doesn't have many changes on that. And those patients definitely have longer lasting result with the steroid injection. In patients who have more severe carpal tunnel syndrome and more significant changes on that nerve conduction study, they'll probably get some relief, but for a much shorter period of time. And then as far as ongoing injections and compromise to the joint and other soft tissues, that definitely is a concern. For me, treatment of carpal tunnel syndrome isn't just injections over and over. One, two, and then at that point, you've really kind of exhausted that treatment option, and your next step really should be a formal surgical release. Um, the concern with steroid injections in the joint, in joints, and this steroid injection for the carpal tunnel is not an injection in the joint, but repeated steroid injections in a small space, is that steroid over time can injure some of the soft tissues and cause some fat atrophy and things like that, even skin hypopigmentation, where there's some skin color change. So you want to avoid repeated injections, which again, for carpal tunnel syndrome, isn't the mainstay of treatment anyway.
Understood. Great answers. The next question, is it common for the numbness that you experience to run up your arm to your elbow or your shoulder?
Absolutely, it can. Typically, we think about more of a downstream problem as far as the compression being at your wrist and having the symptoms in the hand and fingers. But I definitely have plenty of patients who have achiness up their forearm, and some patients even complain of upper arm or even shoulder pain. Now, remember, though, that the nerve is coming from your neck and moving on down, and that's all one continuous nerve with some branches. So when you have an irritated nerve, even at the level of the elbow or the wrist, that nerve can be irritated all the way up, and vice versa. If you have a pinched nerve at your neck, that can be irritated all the way down. I have had plenty of patients who, after surgery for carpal tunnel syndrome, say those entire upper extremity symptoms go away, and that's a wonderful outcome. If they linger, however, after surgery, it may be an indication that there might be something else going on, such as a pinched nerve at the neck.
Excellent. Another symptom question. One of our attendees says that when she squeezes her hand, that she hears creaking in her wrist. Is that typical?
No, that's not typical for carpal tunnel syndrome. Usually there's no noise or really anything visual that you can recognize other than maybe some swelling in the hand and fingers or even in the palm. The creaking, sometimes people can have some popping in their wrist, and that's more in your wrist joint because there is physiologic normal fluid in your joint that is shifting from one place or another, such as when you crack your knuckles, that's what's going on. Some people can also have popping in their wrist if they have arthritis or if they have a tendon snapping somewhere in their wrist. So if you have a creaking or a popping, it may be something that you want to have a medical professional just take a look at to make sure it's not something else.
Thank you for that. Our next question is, you mentioned wearing the wrist splints both at night and during the day. Where could someone find a wrist splint like the type that you recommend?
Yeah, the wrist splints that I purchased my own at Target. That's that gray one you saw in the presentation. You can get them at any pharmacy. You can get them at Bimart, Target, Walmart. Um, just look in the first aid section. They're all pretty much a variation of a theme. I do like the ones that have a little bit of the beads inside the little squishy balls for your palm. I think are very comfortable. You do not want to crank it super tight because you don't want to cut off the circulation anymore. Just the Velcro straps lightly so it doesn't wake you up because your hand is numb from the splint. So just keeping them lightly keeps your wrists straight and in a neutral position. You don't really have to wear the splints much during the day unless you use your phone a lot and kind of need to retrain yourself how you hold the phone and not kinking your wrists in flexion. Because we really don't walk around or during the day much with our hands flexed down. So you really get the most bang for your buck wearing the splints at night because that's when we do unconsciously sleep with our wrists bent. So the splints can give you the best result at night. You have about 6 to 8 hours of that nerve being happy in a nice straight neutral position. And then that gives you benefit during the day with minimizing your symptoms because it's had so long to recover at night.
Thanks. And our final question is, someone's experiencing symptoms and they try to do some of the things you suggest to prevent or treat it on their own, but it's just not working. How do they know when they should come and see you, or how long should someone be expected to put up with symptoms before they start considering things like the corticosteroid injections or perhaps even surgery?
My recommendation is just to come in as soon as you start having problems. And if they're not going away with some of the modification techniques as far as posture at the computer and workstation, holding your phone or tablet, splinting at night, if those aren't working and they're persistent for weeks to months, you do need to come in and have somebody take a look at your hands and they'll be able to know really what is your next step for you because some people come in they don't have their symptoms aren't too bad, they're having a little numbness, want to get it checked out. I get a nerve test and they have no response in the nerves, they're not communicating at all. So it's really best just to come in, have the professionals take a look and guide you which is the best way to treat you. It doesn't mean we're going to push surgery on you by any means, but we want to do the best thing for you, and it's better to catch it early and be able to modify it without having surgery than having a surprise with a nerve that's really not functioning well at all and to the point of permanent damage. So I would recommend just coming on in if it's been weeks to months with persistent symptoms.
That makes a lot of sense. Well, that's our last question. And we want to thank everyone for watching this presentation today. And definitely, most of all, thank Dr. Erin Campaigniac from Samaritan Medical Group Hand, Shoulder Orthopedics in Corvallis. And any other final thoughts you'd like to share, Dr. Campaigniac?
Yeah, just thank you so much for taking the time to sit with your perfect posture at your computer and listen to me. These are my two culprits who started my own carpal tunnel syndrome. And yes, that is a 4 and 5-year-old holding a syringe and a scalpel. I hope this improves your awareness of carpal tunnel syndrome, but also the importance of posture and position, whether you're logged into Zoom for work, a virtual family celebration, or streaming the latest online TV series. But lastly, let's get up and move. Stretch, walk, move around. It's good for your nerves, your health, your mind, and your well-being. Thank you.
Thank you all very much. Have a great day.